Hello, my name is Dr Srikanth V, who is an ideal candidate for breast reduction. Now, people who feel that the breasts are too large for this frame, too large for the size, they feel socially awkward going out, or they have neck pain, they have back pain, they have intertrigo, that is sweat collecting between the skin of the breast and the chest wall and leads to repeated irritation and eczema and discomfort. These are the right candidates to undergo breast reduction. However, what I have seen in my practice is the most common people come asking for breast reduction in the younger age groups are the ones who are socially awkward. They feel a little uncomfortable because they know they look a little different from their other people, from their other family members. They come forward, and in the older women group, I see that they are the ones who have physical problems like neck pain, back pain because of a bad posture. A lot of them have, if they come from a place which is very humid, they have intertrigo, that is skin irritation between the breast and the chest wall. And so these are the kind of people who would come for a breast reduction. What are the benefits of breast reduction? The biggest benefit of a breast reduction is people have a much better self-esteem. Once a surgery is done, it takes about 3 to 4 months for things to settle down, and once this settles down, the people who undergo breast reduction have a improved sense of self-esteem. They are happier with themselves, they are happier with the way they look, they go to the gym, they are able to lose weight, they are able to be more socially active. Also, the people with large breasts, a lot of them suffer with neck pain, back pain, a poor posture, that is hunching. It is in a way trying to hide the enlarged breast. They benefit tremendously because immediately after surgery, within a week or so, when the wounds are healed, you find that your neck pain is gone, your posture is better, you feel much lighter, and the skin irritation which used to happen never happens again. So yes, breast reduction surgery helps to take care of all of this, that is the neck pain, the back pain, intertrigo, and all of the symptoms that you may be coming along with the enlarged breast. When is a breast reduction done? Now, breast reduction is done whenever someone feels the breast is too large for the size of the frame. Yes, it is done in teenagers. It is also done in people who have got married and finished having their children and having after breastfeeding. Now, these are two separate subsects of people, and I would like to talk to you about this because in the younger age group who are not married and not yet had their family and had children and breastfeeding, a breast reduction surgery will leave one major deficiency. They will not be able to breastfeed. They will not be able to breastfeed because we remove fat, we remove gland. There are a lot of techniques that are there which try to preserve the gland, the ductules to a small extent, but I am not convinced how many of them will be able to successfully breastfeed. This is one thing that all youngsters, teenagers, young adults, unmarried people who undergo breast reduction should know, and if they are in the process of getting married or having children, they should discuss it with their family so that they are very clear why they are doing the surgery and what are the consequences of it. Now we have the other side of people where after marriage, after pregnancy, after breastfeeding, the breasts fail to involute. That means they fail to go back or they fail to shrink, which is supposed to be a normal physiological phenomenon. For some reason, even though the pregnancy and the lactation hormones have come down, the levels have come down in the body, the breast refuses to respond and it still remains big. Now they start experiencing features like back pain, neck pain, intertrigo, and they get the breast reduction done. However, to them, problem of not being able to breastfeed does not apply because they've already finished their family, they already finished their children, they purely look for symptomatic relief and for improvement in self-esteem, and they don't mind getting a breast reduction done. Now, this is the main difference between teenagers and adults who have finished their family and the ones who have not finished their family. And this is something that you should consider, discuss with your own family, with your parents, your brothers, your sisters, your fiancés or in-laws before you undergo a breast reduction surgery. One thing about breast reduction surgery that everybody must understand, it is a full-fledged surgery under general anesthesia. So you will have to be hospitalized, and once you are hospitalized, you will be given a lot of painkillers and antibiotics, and after that you will be sent home the next day. Some people may choose to keep a drain, some people may not choose to keep a drain. I prefer to keep a drain because I believe it adds an extra layer of safety in terms of wound healing and wound infection. Now, Once you go home, if you have a drain, you will be taught how to do a drain care. Otherwise, you will be called to the clinic for a follow-up, wherein drain care will be given, and after about 48 to 72 hours, the drains are removed. After this is a time of waiting period. You can have shower the immediate next day. We'll give an antibiotic ointment so that you keep it on the suture line, and you will be asked to use either a sports bra or a specially customized bra following breast reduction so that the suture line heals well. The wounds will heal in about 10 days time. In 15 days time, all the stitches will be fallen off, or which are not fallen off will be removed, and you can gradually return to your normal activities. Very vigorous activities like running, cycling, swimming, or doing pilates or extensive, I think you should wait for about 3 weeks before you can resume all these activities. Like you all know, breast reduction surgery is a surgery where there will be a cut made on the breast is removed, and there will be stitches on the skin. Now the skin heals with a scar. The scar generally is well hidden in a breast reduction. The most common types are done either is something that is shaped like a lollipop or like an inverted T or an anchor shaped incision. Now these scars which are hidden are not of any concern because over a period of time they will fade away. Certain part of the suture line, the lines will be visible. There are a lot of techniques to make it fade away better. Over a period of time, these lines heal better and better. But however, science has taught us that different genetics, different races have different way of healing. So, depending on what kind of healing ability your skin has got, the scar will fade away to that very level. For example, if somebody heals badly even with a simple wound, then you know that probably you will have a little prominent scar, especially the darker South Indian or the darker races will have a prominent scar. However, the fairer population like the Caucasians and all that, they tend to have much better scarring than the darker skinned people. Breast reduction surgery, can it be combined with other surgeries? Yes, most definitely. A lot of the techniques of breast reduction surgery involve reshaping of the breast, that is trying to get you a slope on the upper border of the breast and a dome on the lower border of the breast to make sure that the nipple is in the right summit of these two. The nipple points forwards, upwards and outwards, and also to make sure that the nipple areola lie around the mid-arm line. All these will add to the aesthetics of the breast. Now these are all few calculations which are done, which are to make the breast look better. However, in certain cases of breast lift, that is a mastopexy, when the breast is totally deflated, it may be better for you to have a small augmentation in the form of an implant that is placed beneath the breast, and over that the breast lift is done so that you get a nice pleasing mold of the breast with the nipple and the area pointing in the right direction and in the right angle.